Hello and welcome to Athletic Therapy Now, a podcast for athletic therapists by an athletic therapist. My name is Ashley Burr and I will be your host. Thank you for joining us today. All right, welcome to episode 21 of Athletic Therapy Now. Today we're going to do things a little bit differently. Nikki Smith from Winnipeg, Manitoba. She's a certified athletic therapist, owner and founder of Revolution Rehab. Nikki and I went to school together in university, graduated together, studied together, and today she's going to ask all the questions about myofascial cupping. And so thank you for joining us today, Nikki, and thanks for putting together your questions.
Oh, you're welcome. So given that we're going to do a reverse here and I'm going to jump in and be you and you're going to be your guest. So I'm going to start by letting all the listeners know and viewers know who you are. So Ashley Burr, her and I go way back. We went to university together. She graduated just like I did, from the University of Winnipeg. She has over 10 years of experience as a certified athletic therapist. She practices within a clinical setting with a strong focus on the biopsychosocial model of care and client-centered treatment. She's very passionate about advancing the field. Ashley actively contributes by creating and teaching continuing education courses in pelvic health, myofascial cupping, which is what we're talking about today, and minimalist footwear for healthcare professionals. In addition to her clinical work, Ashley is the host of Athletic Therapy Now podcast, which is where we are today. She has an insatiable thirst for knowledge. She's always diving into the latest research on movement and women's health, much to the amusement of all of us, her colleagues, who joke that really she does absorb every research paper she reads. In her spare time, Ashley enjoys baking, reading, and spending quality time with her husband, son, and pets. You can connect with Ashley on Instagram, Facebook, YouTube, and Apple Podcasts. So that's Ashley. I swear, Ashley, the end of that reads like a dating. Ashley enjoys baking, reading, long walks on the beach. I love it. Okay.
I do love long walks on the beach, barefoot, might I add,
Of course. Aw, along with cupping marks showing on your back for all to see.
Absolutely.
I'm going to use that actually then as my segue. It's not my first question, but I think that is the perfect way for us to get into it. I'm just looking down at my questions here if everybody is wondering. Okay, cupping. Actually, yeah, we'll just get into the questions. We see weird marks. It looks like somebody got attacked by an octopus or a Dyson vacuum. Does it leave bruises? What are those marks that we see on mostly people's backs?
Yeah, so the really short answer there, because I feel like I could talk for a really long time on it, I have an entire course on it, is that those are ecchymosis marks. So they do look like bruises, but they're not tender or swollen to the touch like a typical bruise is. A bruise is where you get hit with something, blunt force trauma, and then you have bruising that's going to last for sometimes weeks. Whereas an ecchymosis mark from cupping is when there's been suction on the tissue, hence the cupping. It's going to bring blood flow into the area, and then that blood flow is going to return back to the surrounding areas. And in that suction, there is some breakage of the capillaries, but it's not tender the same way a bruise is. And they've even gone into it, and they've looked into, there's different research to show that there's potentially healing properties within the fluid in the area where there was cupping. And so with a cupping mark, if you go and you touch it afterwards, it doesn't typically hurt. Sometimes you're going to have some tenderness for 48 to 72 hours after, similar to when you go and you get a really nice massage, deep massage, but it doesn't last longer than that, whereas a bruise can be quite tender, as we all know, for quite a long time.
You can definitely tell you have a course on it. I can tell you're trying to edit and shrink down without getting too much into everything. So everybody, you're just going to have to take the course if you want to hear more about that. Okay. I always love it when people ask me this question, so I'm going to throw it back at you. Cupping sucks out the toxins, doesn't it?
that's a common question, or a common narrative that you're going to see on social media or on the internet, but we don't really know what that means. So that's very subjective as to what that means. We can maybe say that it's going to move fluid around, similar to a massage, but we don't really know what removing toxins from the system means. And when it comes down to it, it's not really a removal of toxins that you're getting into with cupping. It's about a stimulation of the nervous system to help overall body health.
Okay. Fantastic. I'm just making notes so that I can recap everything at the end, just like you do. It's impressive, so I'm trying my hand on it at it here. Okay, so if it's not actually removing toxins, like you said, which we know is really what the liver and kidneys are for, theoretically then, if it's interacting with the nervous system, the longer you leave cups on, the better. Is that true or false then?
I would say false.
Is it more false. Better, Ashley?
So there's lots of different benefits of cupping out there, but the only benefits of cupping that has been proven in research is that it brings blood flow to the area. And so we can conclude that from that it has also, with all the other things that happen, which is decreased pain, increased range of motion, increased strength, and that only happens in some people. So we can't say that that's a 100% guarantee that cupping is going to do that. So when we get those changes in pain and strength, that's a stimulation of the nervous system. But we can see a change in those things after having the cups on for as little as 2 minutes. So when we talk about leaving the cups on longer to get more out of a session, that's really client dependent. So if I have a client that really enjoys the feeling of cupping, and to them it's relaxing and it feels good to them and it helps them feel better, and we're now thinking here, well, it's helping their nervous system calm down. And when I say that, I'm thinking we're regulating that nervous system so that the fight or flight is coming down if they have injuries or pain. Then why not do it? Because it's just going to help them heal. It's going to help their body heal if their nervous system is more regulated. Does that answer your question?
I think like a massage, right?
Like a massage, yeah.
More is not necessarily better.
Yes, yeah. So typically, anywhere between, you can get a really good treatment in 2 minutes, but if clients like to have cups on for 20 minutes, there's nothing wrong with that.
Makes sense. That's good. Get them on, get them off, get on to the next thing.
Yes.
When I'm jumping a little bit around here. With the Nope, going to the next question. Okay. What kind of patient or client what kind of client would you use cupping on? How would they present, or, what are the things in your brain where you're assessing, whether history or subjective or objective, and do you have criteria that you're like, oh, this person would be a good candidate for cupping?
Great question. So I think I'm going to reverse that a little bit, though, because in my mind, I like to start from our red flags, right? So there's the places that we don't use cups, and there's the people we don't use cups on. So as I'm going through my history and I'm going through my red flags and asking about medication, I want to make sure that they're not on high doses of blood thinners. I want to make sure that they don't have, actively have cancer. I want to make sure that they're not actively going through any sort of taxing medical treatments. And then going from there, I want to make sure that it's something that their skin can tolerate, right? So if somebody has very fragile skin, and here's where we're thinking about somebody who's a little bit older, then we don't want to be putting a cup on skin that's very thin. And so that comes into play when we're working with our clients. And then as for clients that I'm like, yes, cupping would be amazing for you. I love using cupping on clients who have plantar fasciitis. I like using cupping on clients who have frozen shoulder, tennis elbow, shin splints. Those are kind of my key, like, we need to do cupping because this is most likely going to be helpful. But I'm always making sure that I'm not forcing clients into it. I'm making that recommendation, and if they like it, if they want to do it, then we'll continue to do it. And if they don't like it, I move on to something else, because if it doesn't work the first time, I promise you cupping is not going to work the second time. It's going to be one of those things where if it works for them, keep at it. If it doesn't work, move on. And then outside of that, I mean, you can still use cupping if somebody has tight muscles. So if a client comes in and they've got pretty severe DOMS, delayed onset muscle soreness, then again, I'm thinking, okay, let's throw some cups on, because there is research to show that it can help to decrease that DOMS feeling, and it can help to decrease the onset of DOMS as well. So often if I have a client where maybe they haven't been working out and I've put them through a fun workout, I might recommend that we finish up with a few minutes of cupping at the end of their session.
Because it's going to calm their nervous system.
Yeah.
So, okay, so what we're getting into then is that cupping is not some kind of hippy-dippy therapy. I'm assuming, well, because I actually know this, but I'm leading you. Is there any research that backs up the efficacy of myofascial cupping?
There's a lot of research out there on cupping, on myofascial cupping. There's now starting to become more research on dry cupping, which is the type of cupping that as athletic therapists we can do. So there's dry cupping, there's wet cupping, which is essentially bloodletting, where they draw a little bit of blood out and then put the cup around that. If you don't have a weak stomach, go and Google it. It's really gross. And keep in mind that that's what your clients are going to see if they Google cupping. And then there's fire cupping. So as ATs, and what I teach on my course is the dry cupping. And so now I forgot what you asked.
Is there research to back up?
Right.
Yes.
So with the research,
you're thinking about wet cupping. It's
yeah. Most of the research out there is on the wet cupping. And in the last 5 years, I've started to see a significant increase on research in dry cupping, and more research on cupping with movement. And when I say that, I mean having somebody put cups on the IT band and going into squats. And so we are seeing that without a doubt, we can say it increases blood flow in an area and it stimulates the nervous system. Those are the things that are pretty consistent across the board. Everything else that we come into play with there, and that we see on social media and research, where it's, you know, this like magical cure-all for decreasing pain and increasing range of motion and increasing strength, those are because of the change in the nervous system, and it's not consistent across the board, so we can't say for sure that those are guaranteed to happen with our clients.
Mm-hmm. And then to go further into that, what are your thoughts on how I'm trying to figure out how to word this. I don't want to say how deep cupping goes. Do you think, or have you found in your research that, I'm actually asking you this on a personal level, have you found in your research that cupping has more effect or an effect really on the fascial layers? Because that's what I talk about with my patients. That's why I'm asking. Am I BSing them? Because this is what I've been led to believe. So I want to make sure that I'm at least being honest with the knowledge I have.
So I think what you're asking is, how deep does it go into the tissue and into the deeper layers? So we know that we can see in research that when we put a cup on, it does increase that tissue stretch. We can see that. There has not been much research past that on how deep it goes. We also know that if we're looking on, you know, the top layer of the tissue, that if you put a cup on, and it's, I'm holding my hands up here on the screen. So if you're not watching on YouTube, just imagine here that you have a cup that's about 1.5 inches. Okay. Now in that 1.5 inch cup, you will have an increase in blood flow 2, 3, 4 inches away from that cup. So we're getting changes 4 inches from where a cup is placed, more so obviously under the cup and close to it, with increased blood flow in the area. So we
And Ashley
can,
is also signaling like laterally out as if it was on the superficial level, not going deep as she's talking about this. Just for those who aren't watching, yes.
Thank you. Yeah. And so we can assume that there's some deeper level of tissue stretch. We can assume that there's some deeper level of blood circulation coming to the area, but we don't know for sure if that is happening. And so I'm just careful when I'm talking with clients. I will say things like, we suspect that it's helping to stretch out those deeper layers of tissue and fascial layers, but we don't know for sure because the research hasn't made it there yet.
Mm-hmm. I think putting 2 and 2 together on the practitioner side, those of us who like to work with fascia and understand that, well, even in, because I do craniosacral therapy, that's extremely light touch, right? Like up to 5 grams of pressure. And that in itself, we can see influences the fascial system. So I like to think that at least you're interacting with the fascial system, which is then interacting with the nervous system and yada, 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 yada. And we know that the fascial system talks back and forth structurally, actually faster than the nervous system, which is a whole other conversation about fascia that we're not going to get into today, but it's always very exciting. But I think...
Go ahead. I was going to continue on that.
I think that's why in part, cupping with movement is so effective, because it's recruiting so many other things that we're really just scratching the surface. When clients ask me why it works, like, could be this, could be this, could be this. Really, we don't know. We're not smart enough yet.
Yeah, and it's interesting because, I mean, that's another thing, is that we see that cupping can work really well and movement can work really well and massage can work really well. But all of those things mixed together work even better.
Yes.
So having that multi approach is more beneficial for our clients. And to go back to that original question there of how deep does it go and do we know? We don't. But on a personal experience, my very, very first experience with getting cupping was actually from Nikki. And this was after I had had a cesarean. So this would have been, my cesarean was 2016. I saw you in 2017. And I had pain and restriction over my lumbar vertebrae where the anesthetist had done the spinal injection for the cesarean. And so to me, I had difficulty with forward flexion of the spine, and I could feel exactly where that spinal injection was. I think I I think he injected me probably about 12 times, just because he wasn't getting what he wanted out of it. He wasn't getting the effect. Anyways, I suspect that's more than typical because when I hear from clients, it's not 12 injections that they're getting into their back. And so I suspect there was some scar tissue, or maybe there was just some, psychological feelings and my nervous system was just not happy with it. But whatever it was, Nikki put one single cup over top of the spot that I had restriction. And we're talking like I couldn't lean forward and touch my toes when I have been able to my entire life, because it felt like something was going to rip in my back. And so Nikki put this one cup on. We did some cat-cow. She took it off and it was like 70, 80% better, maybe even more. And then a week later, I came back, second session, same thing, and it was gone, and I've never felt it again. So that was really cool and leads me to believe that, yes, it's possible that it's stretching tissues out at a deeper level. So thank you, Nikki.
I don't remember that. I remember working on the other scar tissue manually, but I don't remember cupping your back. This is why we chart. Yeah. That's lovely. And now that I've gone through that, I can tell that it's that many injections or needle pokes is not typical. But even with one, I still needed work back there. And I have clients that also who have had to have that done as well without getting into all of that.
Yeah.
Yeah, the body remembers, the body keeps the score, which is also a very good book. But yes, the nervous system remembers. On the practitioner side or on the regular public side, who can do cupping?
Yeah, great question. Um, so I will teach clients how to do cupping on themselves, and I tell them not to cup on friends and family members because we don't know if it's safe or not, right? They don't have the ability to assess whether or not cupping is appropriate. I also tell them that if it's a new injury and they've never cupped it before, they should always come in for an assessment so that we can, one, make sure that they're not going to make anything worse, and two, we can teach them how to cup that area, and then they can take their care on their own, and they can do that. They still come in. People always ask, why do you teach your clients how to cup when that's just going to take your clients away from you? And it doesn't. My most loyal clients, the ones that I have seen for the last 10 years that I've been working, are all clients that I've taught to cup, and they cup when they're at home, but they still come in for treatments when they need me. And they come in for assessments and anyways, yeah. So at a base level, somebody who has no understanding of anatomy in the way that we do as therapists, they can cup themselves. It is not recommended that they cup other people, and it's always recommended that when they're doing cupping, they've had that education from a therapist or somebody who knows how to cup. Now, in the courses that I teach, I recommend that people have at a minimum their anatomy and assessment, or at least going through the process of taking an assessment course. So I do have students that take the cupping course, and it's just easier because when I'm teaching the course, it's so condensed into 9 hours, and when I'm teaching the placements of cups, I'm using anatomical terms. So you could get by, but anatomy is essential.
Is there anything else that you would like to share that I haven't asked? Anything sitting in your brain that you feel like you need to get out there to let people know about cupping specifically, not fascia or the nervous system or the rest of them?
Yeah, I think the biggest thing that I want to get across when talking about cupping is, and I've already said it, right? Cupping is great when it's great, but don't keep pushing it on our clients when it's not great. So we try it if our clients want it, and if it doesn't work, move on. And, you know, there's if you follow different therapists on social media, you'll see one side where it's this magical thing and the other side where it's like, why the hell are you using this? Because it doesn't do anything. And it's not that it doesn't do anything. Those therapists who are, and you'll probably know who I'm talking about if you follow them, and I'm not going to name names, but those therapists who are saying things like, don't ever use cupping, it's crap, it's BS, et cetera, they're not actually complaining about the use of cupping as a therapeutic device. What they're complaining about is the way that we talk about cupping as this like all magical, it's going to fix everything, and relying on it and using it to a severe amount where we actually cause tissue damage. So as long as we're not going into severe amounts of pain with cupping, and as long as we're not saying it's this all magical thing, and we're using it appropriately, it's safe for our clients, it's good for our clients, and it's helpful for our clients. Does that?
And I think it's an affordable continuing education tool for therapists to add to their toolbox that doesn't challenge their entire treatment paradigm like other courses out there, like, for example, acupuncture, right? That you really have to look at the body in a different way. So I think cupping is a really nice adjunct for new therapists or students as well.
Yeah,
It's easy for
absolutely.
them to grasp.
Absolutely. And I think it's a nice way, if you're a manual therapist that really works with your hands, it's a nice way to, I'm using quotes here, loosen up the tissue, or to work on the tissue so that you can save your hand. Oh, I don't know why. And if you're if you're on YouTube, you're gonna see the balloons that just came up in my background.
I saw that.
I don't know what does it. Somebody told me it's if you do a peace sign, and I'm doing it again and it's not happening.
That
Anyways,
was fun.
those were my
Cupping.
quotation marks that brought balloons everywhere. Sorry, apologize.
That was fun.
Easily distracted here with balloons. So yes, it can be a really helpful tool to have as a therapist if you're the type of therapist that works with your hands. And I think that as we get out of university and we get started with working with clients, typically that's the biggest thing that we know how to do is manual therapy with our hands. And so that's where cupping can be super incredibly beneficial, is to save our hands a little bit, save our wrists a little bit. And for the most part, 90% of clients love the feel of it. They love the relaxing feeling afterwards. They like that they can feel taller, or they can feel relaxed, or they can feel that they have more energy. And the clients who use it on their own at home, they love that they can use it when they have to travel for work or sports. And it can help to just make their quality of life better when they're on an airplane all the time.
Yeah, that makes sense. So, are we ready for my recap?
We are.
Okay. It's out of order, but all right, here we go. So, cupping, both wet cupping and dry cupping. And I was going to ask you about wet cupping, but you covered it enough. Neither of us are fans. It's not in our scope of practice. Wet cupping is where you basically open up the skin, put a cup over, and bring the blood up to the surface and out. We are not qualified to do that. So we do something called dry cupping. Dry cupping is now, within the last 5 years, supported by research. So there is an effectiveness to it that is backed up by research. We don't quite understand why in every aspect, no matter what any of us says, but we do know it works. Just like massage. We know it works. We don't always know why it works. No, it's not sucking out toxins. It's really just interacting with the nervous system. It's going to increase blood flow as well, which is going to basically down-regulate everything. It's going to help the body cool its jets in a lot of the cases. Leaving cups on longer is not necessarily better. So you're looking at a minimum of 2 minutes usually, which is honestly 2 to 5 minutes is about what I do as a practitioner, but I know you said up to 20. If the clients if they're really digging it, then great. But longer is not necessarily better. Does cupping leave bruises? The word actually used that most therapists forget is ekmosis, which is a color change in the skin. We're not really damaging blood vessels, so it's not exactly like a bruise, so it heals faster. It might look nasty, but it's also not going to hurt. Although we usually just say bruise because everybody knows that that's what that looks like, that kind of inky color change. Who can get cupping? I think in a nutshell, it's mainly healthy people, fairly healthy people, or at least not really compromised people, or people on medication, dealing with blood pressure issues, blood thinners, that kind of thing. People who have skin that can handle it. Who can do cupping? Honestly, anybody can do cupping. But you should not be treating anything unless you are a therapist who has taken a course, take Ashley's course on cupping. I personally, just like Ashley, teach clients how to do it on their own, and it's a fantastic tool. Can you buy cups online? Yes, you can buy cups online. Really, if you're going to use them, speak to somebody who is trained in it. Cupping is not the be-all end-all, just like any treatment modality. So a lot of people love cupping, just like a lot of people love massage or acupuncture or exercise. None of them, although exercise is pretty fantastic, but none of them is the be-all end-all on its own. So cupping is one tool in the toolbox that I think both Ashley and I highly recommend that every manual therapist add, simply because it is so effective. It's very low cost. It's very low risk. And that's my summary.
Yeah, and to add on to that, I mean, the low cost, I run my courses and I often run them with pretty good early bird deals. Right now I've got a course coming up. Yeah, I've got a course coming up in Winnipeg, Manitoba, and I'm just pulling up my prices here because I don't want to Be wrong. So the course is May 4th, 2025. May the 4th be with you. And
You nerd.
Nikki's making a face. The early bird rate ends on March 10th, and it's $50 off. The course itself is $375. So if you take it and you register before March 10th, the course is $325, and that includes a cupping set, which costs $100 or a little bit more than that in the stores now. So again, the course is running on May 4th. I often run a course at least once a year in Winnipeg, and I try to get into some of the other provinces as well. If you're interested in hosting a course, please reach out. You can always reach out to me on my email is best, ashley@burrathletictherapy.com. If you reach out on Instagram or Facebook, it often hides it, and so I don't see it right away. So once again, you can just reach out on my email. And if you're interested in hosting or if you're interested in taking a course, you can hop onto my website, burrathletictherapy.com, BURR athletictherapy.com. And yes, Burr, like it's cold in Winnipeg.
That's awesome.
And then registration will be under the continuing education courses there.
Highly recommended. I've taken Ashley's courses before. She's a great instructor, and she's I think really good at supporting other practitioners' methodologies and integrating them into her classes. So I highly recommend taking Ashley's courses.
Thanks, Nikki.
Yeah, you're welcome. Well, you and I talk constantly about stuff, and I really, really, really enjoy it. And I've taken your courses, and I enjoy those too.
Perfect, thank you. And if you want to hear more from Nikki, she's been on a couple of episodes. You can just pop onto the website or any of them. And I think she started off being on episode 2 of podcasts. So if you scroll all the way back to there, you'll find her. She's been on a couple of more, and you can find her at Revolution Rehab.
Revolutionrehab.ca.
There we go.
Yep.
All right. All right, thank you so much for asking me these questions today, Nikki. I really appreciate you coming on and taking the time.
You're welcome. It was a lot of fun, and I'm glad that you didn't have any chance to prepare them. I figured you teach it, so I'll just throw them at you, and we'll see how it goes.
Way to put me on the spot.
You're welcome.
All right, have a great day.